Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. If you've ever been told you need a CT scan, you may have wondered, why not an MRI? Or maybe you've had an X-ray first and thought, wouldn't a CT scan be better? The truth is, every imaging exam has strengths, limitations, and a specific purpose. Today, we're exploring how doctors decide which imaging test is the right one for you. Medical imaging isn't ordered at random. Every examination begins with a clinical question. Your healthcare provider gathers information from your symptoms, medical history, physical examination, and sometimes blood work or other tests. Only then do they decide whether medical imaging is needed, and if so, which examination is most likely to provide the answer. The goal isn't to order the biggest or most advanced scan. The goal is to order the right scan. Many people assume MRI is always the best imaging test because it produces incredibly detailed images. But more detail doesn't always mean better information. MRI examinations typically take longer, require patients to remain very still, and aren't the best choice for every situation. For example, if someone arrives in the emergency department after a serious car accident, speed is critical. A CT scan can evaluate multiple parts of the body in just minutes, helping doctors identify life-threatening injuries quickly. Choosing the right exam depends on the clinical situation, not simply which scanner is newest or most advanced. Sometimes the simplest examination provides exactly the information that's needed. If you injure your wrist or ankle, an X-ray is often the best first step. It's quick, widely available, and excellent for evaluating bones. If the X-ray answers the clinical question, additional imaging may not be necessary. Using the most appropriate examination first helps avoid unnecessary testing while still providing excellent patient care. Ultrasound is another great example of choosing the right tool for the job. Because it uses sound waves instead of ionizing radiation, ultrasound is commonly used during pregnancy. It's also excellent for evaluating the gallbladder, thyroid, blood vessels, muscles, tendons, and many other structures. In many situations, ultrasound can answer the clinical question quickly without the need for CT or MRI. Sometimes one imaging examination leads to another. For example, an X-ray may identify a problem that requires a CT scan for more detail. An MRI may then be performed to evaluate soft tissues surrounding the injury. This doesn't mean the first scan was wrong. Each examination provides different information, helping your healthcare team build a more complete picture of your condition. Let's look at a few real-world examples. Imagine someone arrives at the emergency department with sudden weakness on one side of their body, difficulty speaking, and facial drooping. These are possible signs of a stroke. Many people assume an MRI would be the first choice because it provides detailed images of the brain. But in many emergency situations, a CT scan is performed first because it's extremely fast and can quickly help identify bleeding in the brain. That information is critical because treatments for different types of stroke are very different. Depending on the situation, additional imaging, including MRI, may be performed later to provide more detail. Now, imagine someone twists their knee while playing soccer. The first imaging test may actually be an X-ray. Even if the doctor suspects a ligament injury, the X-ray can help rule out a fracture or other bone injury. If the bones appear normal, but the symptoms suggest damage to the ligaments, cartilage, or meniscus, an MRI may be ordered because it's excellent at showing soft tissue structures. In this case, the X-ray and MRI each answer different questions. Now, let's consider someone with pain in the upper right side of their abdomen after eating. Although CT and MRI are powerful imaging tools, ultrasound is often the first examination for suspected gallbladder disease. Ultrasound provides excellent visualization of the gallbladder, can identify gallstones, and allows the sonographer to assess the area in real time. It's an excellent example of choosing the right tool for the right clinical question. Here's another example. Someone arrives with sudden, severe flank pain that's suspicious for a kidney stone. In many adults, a CT scan is often selected because it can quickly identify stones, determine their size and location, and help evaluate other possible causes of pain. The decision is based on which examination is most likely to answer the clinical question quickly and accurately. One of the biggest misconceptions about medical imaging is that one scanner is better than all the others. The truth is that every imaging modality has strengths and limitations. X-rays are excellent for evaluating many bone injuries. Ultrasound provides real-time imaging without ionizing radiation. CT scans are incredibly fast and detailed. MRI excels at imaging soft tissues. Nuclear medicine shows how organs and tissues are functioning. Rather than competing with one another, these technologies complement each other. Choosing the right examination means selecting the one that provides the information your healthcare team needs to answer the clinical question safely and effectively. Medical imaging isn't about ordering the biggest machine or the most advanced technology. It's about asking the right question and choosing the right tool to answer it. Every examination is selected because it offers unique information that helps guide diagnosis, treatment, and patient care. We hope this video has helped you better understand why different imaging exams are used and how your healthcare team decides which one is right for you. Thanks for watching In the Know Medical Imaging, where we make medical imaging easy to understand. If you enjoyed this video, please like, subscribe, and share it with someone who's curious about the fascinating world of medical imaging. We'll see you in the next one.